Like so many women, Dianne Gooch lived for more than a decade unaware of the tinderbox inside of her chest. 10 years ago, doctors diagnosed Gooch with heart failure and sent her home with medication.
I thought, okay, I'm taking the medicine, that's it. I had no knowledge. I didn't know what to eat, what not to eat, what to do, what not to do.
But last year, after gaining 51 pounds of fluid, she found herself in the emergency room here at the Arkansas Heart Hospital in critical condition. This time under the care of Dr. Vijay.
She was a patient that presented to the hospital with shortness of breath and just gross volume overload or extra fluid on board. She was diagnosed with what we call non-ischemic cardiomyopathy, so those patients that don't actually have blockage but have a weakening of their heart function.
It is by far the #1 killer of women over the age of 25. More women die of heart disease than cancer. Yet it's often thought to be primarily a threat to men. Dianne Gooch and Dr. Raja are hoping to help change that perception.
I could have prevented so much.
The symptoms are different in women than in men. Women typically won't have the chest pain, but will have shortness of breath, numbness, back pain, or an unexplained onset of reflux. Cardiovascular diseases risk factors include smoking, poor diet, high cholesterol and blood pressure, obesity, physical inactivity, and family history.
It's not required, but after a certain period of time with certain risk factors, we start thinking about, well, how do we address your risk?
The upside, the vast majority of heart disease is preventable through lifestyle changes.
Heart failure is very much a disease state and diagnosis that patients who are very cognizant of that disease and able to be proactive about it can actually control their hospitalizations in a lot of these situations by controlling their weight, controlling their diet, and following the instructions that they're given.
Gooch even keeps a photo of Dr. Raja and her dietitian on a refrigerator as a reminder.
I keep them on my fridge because then if I go and I think, what the heck, I'm going to go ahead and get that anyway. I can just see those two go, Failure is not an option. If I don't follow through with this, I'm either going to be very sick and lose my independence or possibly die.
For today's Heartbeat, I'm Jancy Sheets.
Today's Heartbeat is sponsored by Arkansas Heart Hospital.
Jancy, thank you so much.